In this segment, I'm going to give you the swine flu statistics. How many people are sick? How many people have died? How fast is it spreading? But before you listen to these numbers, you must understand that the numbers are very inaccurate. They're wrong. Okay, why is this? Well, let's remember when the swine flu first broke out in Mexico. And I remember hearing that 50 people had it, that 70 people had it, that hundreds had it. Then it went into the thousands. Then those people were tested with the swine flu viral test. And it was discovered that only two of these people actually had the swine flu, and the other 1,000, 2,000, 3,000 had headaches, upset stomachs. They had a regular cold. They had asthma, emphysema, bronchitis, a cough from being too dusty or too dry. They had an influenza, but it wasn't the swine flu. So remember that many people panic and go to the hospital, but very, very few of these people actually had what we could call the swine influenza or the swine flu virus. Secondly, the next thing you have to remember is that the test for the swine flu is more than 50% inaccurate. Viral testing is very iffy, my friends, especially when you're trying to test for a specific virus. So the viral testing is inaccurate. Over 50% inaccurate means that you could put a few monkeys in a room with a dial that says yes or no, and they would come up with the exact same results of how many people have the swine flu. So think about it. The vast majority of people that think they have it don't have it, and the testing for it is very inaccurate. Now, beyond that, a lot of people that have it don't go to the hospital because it's a very mild flu. So there's a whole other group of people that just don't get reported. And if they do report it, remember, hospital records are highly inaccurate. So I'm putting together this picture that viral reporting is extremely inaccurate. The research is inaccurate. The testing is inaccurate. The reporting is inaccurate. It's wrong. It's iffy. And then imagine this iffy information is then further massaged and spun by our politicians, by pharmaceutical companies, insurance companies, medical groups and associations. So you have to take this all with a big grain of kelp. The swine flu numbers. Okay, right here in the United States, it's estimated that there's been about 50,000 confirmed cases of the type A H1N1 swine flu virus. 50,000 people have been infected and approximately 700 deaths. Now, this number will grow this winter, and it may grow dramatically. We can expect a lot more people getting this flu, and certainly more people dying from it. Worldwide, there's been approximately 400,000 infections of people with the swine flu virus. That's the H1N1. And about 4,500 deaths. Now, we can also expect the amount of people getting infected to grow and the amount of deaths to increase. Now, what about the spreading? Is it spreading fast? It's spreading extremely rapidly. We must remember that so far it's remaining a mild influenza, but it is spreading very fast. So what's the number one country with the most infections and the most deaths? Well, my friends, unfortunately, it is the United States. The swine influenza is spreading rapidly across the United States. In fact, we have 12.5% currently of the amount of infections and deaths of the entire world. So we are number one in many ways, my friends, but we're number one with the swine flu. Now, what does the CDC say, or the Center for Disease Control? Well, they say that it's going to infect millions of Americans this winter based on infectious disease models. Now, what does WHO say, the World Health Organization? Well, they say that the swine flu virus is an unstoppable pandemic, a worldwide pandemic that's going to affect all countries of the world, and we need access to vaccinations immediately. Now, what about the drugs? Well, 195 million doses of the untested H1N1 swine flu vaccine are scheduled to be released in October in America. My God, I can't even imagine what's going to happen to people's immune systems by injecting this poison into their body. It's untested. Remember that word. Remember, friends, most flu vaccines don't work. If you want to know more about that, read my special report. But most flu vaccines don't work. And on top of it, they're highly toxic and poisonous, filled with everything from mercury to antifreeze. Horrible, toxic, poisonous stuff. Not to mention infected pus from animal organs that died from the flu. It's nasty stuff, my friends. Okay, millions of doses of the vaccine and antiviral drugs are going to be spread around America to further weaken the immune system of Americans. So, my friends, this could be a bad season. The CDC recommends that 80% of the American population get inoculated, further weakening our immune system. So what can you do instead? Well, first off, I'm going to take to the streets of London, where the swine flu pandemic hit hardest in all of Europe. I went to London because apparently, according to the statistics, there have been massive outbreaks in London and England and the entire UK. And there's been thousands of people who have gotten sick and infected with the swine flu. There have been many that have died. And so I want to go to ground zero to see exactly what's going on with the swine flu. Because overnight, Britain was attacked and it became a pandemic. So let's see what we discover. Then after that, I'm going to give you 10 common sense and natural ways that you can prevent the flu and even prevent the swine flu. I'm also going to give you 8 herbal medicines to prevent and protect you from the swine flu and then treat it if anybody in your family gets sick. And then I'm going to give you a 7-step program to get rid of the swine flu in 24 hours, my friend. A powerful Dr. Schulze 7-step program and much, much more. So here we go. Let's get out on the streets.